Hi, my name is Kara Sable, Wellness and Benefits Administrator at Aspen Valley Hospital, and today we're going to take a look at Total Worker Health at AVH. Total Worker Health is a CDC NIOSH initiative, which is a holistic approach of looking at worker well-being. So it's really taking wellness and safety and combining them together to provide the ultimate worker well-being. At AVH, we have a couple of things, one of them being the Work Comp Collaborative, which is a comprehensive support approach to return to work after an injury. So myself, your manager, and Amy Bearhorse and Employee Health work together to provide support in getting you back into a modified duty or returning to work as soon as possible. We also have a robust wellness program called Evolve that we'll talk about a little bit later. There's integration between work comp and well-being. We take a look at your workspace and provide ergonomic evaluations on those workspace. And we also have the Green Up Cleanup. The Work Comp Collaborative, we ask that you report work comp claim within 24 hours of injury. So we talk a lot about incident versus work comp claim. So if it's an incident, you're still submitting the paperwork, and let's say you roll your ankle in the parking lot and you think, oh, it's fine, and you submit the paperwork and then nothing happens. It stays an incident. But maybe you roll your ankle and then you need to go seek additional care and it becomes that work comp claim. So if you didn't report it, then you would kind of be out of luck if you needed that additional care. Medical care and follow-up, so ER versus designated provider. We are a hospital. The ER is, right down the hallway, but we do pay for everything. So we try to be conscious of what we go to the ER for. And we have a list of designated providers, Aspen Valley Primary Care being one of them that you can go to. Return to work. As I mentioned, we work with your manager on creating those modified duties. Sometimes it's not even in your department, it's in a different department, but if we can get you into work and give you that comprehensive support, then you're gonna get better faster and you'll return back to your normal position quicker. Now, normally I would have you all stretch because we're in our orientation classroom down in conference room A. So if you'd like to get up and do a little stretch right now, then go for it. I know that this is new and different, so thank you for having orientation this way. The hospital's mission statement is to be the leader in fostering our community as the healthiest in the nation, and that includes all of our employees as well. We are part of the Valley Health Alliance, which is the 6th largest employers in the Valley that come together to leverage wellness resources. So it's ourselves, Valley View, SKICO, the City of Aspen, Pitkin County, and Mountain Family. And we come together at a board level and an HR level to really collaborate all of our efforts in the ultimate goal of reducing healthcare costs. Evolve is the name of our wellness program, as I mentioned before. Our wellness committee came up with this name, and they came up with it because we decided that health is not an endpoint, it's a process throughout our lifetime. So you can always become a healthier version of yourself. We do have a very robust wellness committee, so if anyone is interested in participating, please just shoot Amy or I an email. Back in September 2015, we did become a tobacco smoke-free campus. So you'll notice that our campus extending to employee housing and the parking garage and even health and human services is all tobacco smoke-free. We do have resources available. We have the Colorado Quit Line available to everyone. And then if you are on our health plan, we offer reimbursement for smoking cessation and zero copay for nicotine replacement therapy as well. The Evolve Wellbeing program is integrated into the health plan. So by participating in the program, you have a $100 monthly savings on your premium, $120 if it's you and your spouse participating. So we start everyone off in the preferred premium, meaning that you have that $100 monthly savings. And we ask that you continue to participate in the program in order to lock in that preferred premium for the following year. Virgin Pulse is our wellness platform. So if you were to go to join.virginpulse.com/AVH or download the app, you should all be able to, and this is for full and half-time, you should be able to register and create your account using your first name, last name, and date of birth. So Virgin Pulse works in a point system. So currently we have a point goal of 1,600. All of you being new hires currently are kind of grandfathered into the program. So you don't have to do anything currently until September when we start the program over. So here are some examples on how you can accrue your points. So we have things that happen monthly, quarterly, annually. So we have our biometric screens you can see down at the bottom. So any improvement in blood pressure or glucose, you would get incentivized for year after year. Or if you hit that metric from the beginning, then you would get that point allotment. And then we have journeys. We have, if you hit your steps 20 days out of the month, then you get a chunk of points. Preventative care exams, the list goes on and on. So there's plenty of options for you to accrue your points. There are two main things that happen every fall, and they are kind of the beef of the program, and that's the health screening that we do annually every September, and then health assessment, which is on the Virgin Pulse platform, and that's just a self-report questionnaire. And we take this information and we aggregate it, and we look at it as a VHA, and we also look at it as AVH to be able to take a look at what our population looks like, and then implement the necessary education or resources to hopefully improve those biometrics. As I mentioned, our health screenings are September through December. It takes a look at, or it measures body mass index, cholesterol, BP, triglycerides, waist circumference, and glucose. So year after year, they'll be uploaded to the Virgin Pulse platform, and you'll be able to see if you've had any improvement, or maybe you can slowly see something inclining like your blood pressure, and then take control and manage those numbers. So you'll see a lot more information coming out in the HR Weekly Roundup when it's towards August to promote the September health screens. We also have a campaign called Know Your Physician. And researchers have found that patients with a primary care have better management of their chronic diseases. They lower overall healthcare costs, and they have a higher satisfaction with their care. So primary care visits are a huge part of our wellness program. They're incentivized, so they're weighted heavily, and we have a primary care verification form that we would ask that you bring to your PCP visit and have them sign off on it. And then there's instructions on where to mail that into to get those points. We also have a ton of in-house wellness events outside of the Virgin Pulse platform. We have a monthly healthy snack cart that, we have a different snack every month that we walk around and let people taste. We've done wheatgrass shots before. We've done chocolate covered pretzels, so you never know what you're gonna get. We offer retirement planning quarterly. So MRP, our retirement advisors, come up and do one-on-one financial advising. These are great to take advantage of. I highly recommend it. Everyone is eligible for the 457B, which is equivalent to a 401k. So we start everyone off at 6%, not 5%. And if you don't want to participate in this, if you're not full or half-time, then we would ask that you log into principal.com and turn that percentage to 0, or shoot me an email and I can assist with that as well. We offer race reimbursements, so you can turn up to 5 bibs in for $10 a piece reimbursement. We just need the receipt or the bib. And then we do other events in-house like fitness bingo, Eat the Rainbow will be coming in June. January, we do a Kick the Sugar. The month of April, we're doing a gratitude journal. So we're always coming up with new ideas. Some additional perks that we have, as I mentioned, anyone that's seated at a workspace qualifies for an ergonomic workstation setup. So if that's something that you're interested in, shoot your email or email your manager, and then they'll ask me to set it up with the ladies up in physical therapy. The Cardiac Rehab Center, so once you attend orientation and you sign the consent form, you're allowed to use this space during non-clinical hours. So we'll figure out a time when to do an orientation here in the next couple weeks after things kind of roll back to normal. Gym memberships, we're in the process of kind of revamping this as well. So hold tight on this. We don't really have any great corporate memberships, but we're working on revamping this benefit. Everyone is eligible for a free WeCycle membership. AVH is actually one of the founding sponsors in WeCycle, so you'll notice that we have a station right outside in our parking lot. The bikes are usually back the mid-May, and they've partnered with RAFTA, so you'll notice that all of the bike stations are also at bus stops, and you have 30 minutes that you can use a bike for before you have to redock. We also have Car2Go and discounted bus passes. So with the bus passes, if you're full or half time, we give you a $40 ride pass for $8 payroll deduct, and you can get one a week to come to and from work only. And you would just stop by HR to pick up that pass. Taking a look at your workspace, again, I mentioned the ergo evaluations and just the awareness of your environment. We really believe that having a comfortable workstation, it means that you're going to be happy and productive employees. So if there's a light that's flickering or a vent that's blowing on you, or your chair is too low or too small, reach out to Amy and I. We're here to improve your workspace and make it functional for you. And then last but not least, we have the Green Up Cleanup, which is our recycling initiative that Amy and I started a couple of years back. So we thought that, you know, our vision as AVH is to be the leader in fostering the healthiest community in the nation. And that we should really be good stewards of our resources and the beautiful place where we live and kind of extend that vision. The average hospital generates 28.4 pounds of waste per patient per day. So we came together to create the Green Up Cleanup initiative. And we also have a Green Up Cleanup committee that has about 30 ambassadors. So if anyone's interested in partaking in that committee, reach out to Amy and I as well. So we do single stream recycling at the hospital. So these are everything that can go into one bin. Newspapers, paper, I would say the big no-nos are no straws, no plastic straws, or no napkins. And then gloves is another big contaminant that we see. So pizza boxes, they actually cannot be recycled. There's too much grease on them, so it contaminates the recycling. However, pizza boxes can be compostable. So we also compost back of house in our cafe. And we do have multiple compostable materials within the cafe. So like our to-go containers, our coffee cups, you can actually leave those compostable items and any excess food on the cafe tray belts, and our cafe staff will clear that into composting back of house. So that's actually a huge landfill waste saver by composting. We have the biggest impact on our landfill by composting. There's a couple of forms that you'll have to complete in HealthStream just to sign off on. So we have the designated medical provider form. So that's just showing what designated providers we have available. And I believe Aspen Valley Primary Care isn't updated to that form yet. So I will update that. And then there's also this general safety rule that we will have you review and sign as well. Thank you again. And if you guys have any questions, please feel free to reach out to Amy or myself. We are so glad to have you guys. Thank you.